symptoms. Next, confusion is which symptom? Symptom related to your neurological status. Okay. And what is the history? He has recently returned from a cruise. That's it. You need not even study the remaining question also. Right? So straight away, what it will be? It will be Legionella pneumophila. Okay. So Legionella pneumophila, what did I tell you? I told you Charlie legs. Charlie legs, right? Charlie in the sense charcoal yeast. Leg in the sense Legionella. So where do you culture Legionella? In Charlie's eggs, that is charcoal yeast. Clear all of you? Very, very, very good. Right. And here, these are not new things over here. These things we have already discussed in the staining techniques, okay, in the culture methods. McConkey agar, why do we use McConkey agar? Any idea, anyone? You remember, I told you that in McConkey agar, we differentiate between. Very good, Fatima. In McConkey agar, I told we will differentiate between lactose fermenters, non-lactose fermenters. Very good, Nishoka. Lactose fermenters and non-lactose fermenters. So for that, we use McConkey agar, right? So lactose versus non-lactose fermenters. Next important thing is eosin methylene blue. Okay. E stands for eosin. E also stands for E. coli. Remember that way. E stands for eosin. E stands for E. coli. Chocolate agar. What? How do you remember this? I told you to remember. Chocolate influences. Chocolate influences girls. Right? So what is chocolate here? Chocolate is chocolate agar. Influences is Haemophilus influenza. Girls here is gonorrhea. Clear all of you? Right. Next, mannitol agar. Mannitol salt agar is Staph aureus. Mannitol salt agar, Staph aureus. Eaten agar. What is eaten agar? Eaten agar is eat my pneumonia. My in the sense mycoplasma pneumonia. What is this? My in the sense mycoplasma pneumonia. For mycoplasma pneumonia, we use eaten agar. Okay. Right. Now coming to another group of gram-negative rod bacteria, right? So this gram-negative rod-shaped bacteria is your typhoid bacteria. All of you know you have got typhoid and you have got typhoid fever. You have also got paratyphoid fever, right? So very good, all of you. This is mainly caused by what? Salmonella typhi. Very good. It is caused by Salmonella typhi. Now, before we enter into the real processes, first we shall write down some important steps here. First important thing is that this is caused by Salmonella typhi. This thing you all of you know, Salmonella typhi. So I'm writing completely Salmonella typhi. This is caused by Salmonella typhi. Second important thing is this is a gram-negative rod-shaped bacteria. What is this? It is a gram-negative rod-shaped bacteria. Third important thing is if this is a bacteria, if this is a bacilli, right? Gram-negative rod matlab bacilli hi hoga. If this is a bacilli, surrounding this bacilli, there are flagella like this. Okay. Surrounding this bacilli, there are flagella. So flagella are present all over the bacteria. So I'm calling it as Peritrichus flagella. Peritrichus flagella. I'm calling it as Peritrichus flagella. All of you are clear till here? Next, fourth important thing is there is an agar. Okay. There is a specific agar. The name of that agar is TSI agar. TSI agar matlab triple sugar iron agar. What is this? This is called as triple sugar iron agar. Triple sugar iron agar. If you are growing this bacteria within this triple sugar iron agar, this bacteria will start releasing hydrogen sulfide gas. Okay. Very, very, very important question. Right. So on triple sugar iron agar, what is going to happen? It will release what? H2S gas, hydrogen sulfide. Next. Fifth important thing is that now when I am doing a McConkey agar, the colonies here will be colorless. When I tell the colonies are colorless, अभी ये बताओ, it can ferment lactose or it cannot ferment lactose. बताओ. What does colorless colonies mean? Very good, very good. What did I tell you? Colorful colonies, they are which color? Colonies which are colorful, they are pink, right? Colorless colonies are colorless one. I mean, those who do not ferment are colorless. Those who ferment lactose are pink. So here, it cannot ferment lactose. It cannot ferment lactose. It cannot ferment lactose. Okay. So this is all you need to know regarding Salmonella typhi. Now, when it comes to Salmonella paratyphi, how many different types of Salmonella paratyphi do we have? First important thing is we have got paratyphi A. Okay, we have got paratyphi A. We have got paratyphi B. Paratyphi B. We have got paratyphi C. Paratyphi C. And there is also a fourth important one that is called as coli ray suis. Okay. Cholerae suis. This is another type of paratyphi. So overall, how many paratyphis we have got? We have got four different types of paratyphis. Okay. Why? Whatever it is, Salmonella typhoid will cause typhoid, all of you know. Now, what is the route of entry of this organism? Obviously, all of you know the transmission is fecal-oral route, right? All of you know the transmission. The transmission is what? Batao? What? Very good, very good. The transmission is what? Fecal-oral route. Transmission is fecal-oral route. This is the way of transmission, right? Pathophysiology here is extremely important. Extremely important. What is the pathophysiology? I'm going to tell you now. All of you just look at this particular picture. Now, in this, what is going to happen? Just follow this picture here. First important thing, let us say I have drank water which is containing Salmonella typhi. Okay, contaminated water. Now, after drinking that water, what will happen? Just follow, look at this. After drinking that water, what will happen is that this Salmonella typhi over here, it has entered into, okay, let me use this, good enough. Or let me use red only. Yeah, this is fine. See, this Salmonella typhi is entering into my intestines, right? Where is it reaching? This Salmonella typhi, all the way it reaches down till the distal ileum, distal part of the ileum, the complete end of the ileum. Okay. Within the distal part of the ileum, you have got special cells called as Peyer's patches. Okay? There are some special structures that are located. They are called as Peyer's patches. Beneath the Peyer's patches, there are macrophages. ये देखो ये macrophage है. Beneath the Peyer's patch, what is there? There is macrophage. Now what I'm telling you is that, I'm sorry. Now what I'm telling you is that once after the oral uptake, the bacteria will go down all the way till the Peyer's patches. It will enter into the Peyer's patches. From there, it is coming down and entering into your macrophage, right? And what it will do? It will infect your macrophage. What will it will do? It will destroy and infect your macrophages. From the macrophage, it is going to enter into your blood. Once it enters into your blood, in the blood, it is going to cause an infection called as septicemia. Septicemia. Okay. So finally, the infection of septicemia is caused in the blood, right? So when septicemia is caused, patient will have what? Patient will have fever and all these things. Now this bacteria, again, it is going back into the same intestine. From there, where it is going, it is excreted out into the feces. You understood this? I'm not telling you the life cycle. I'm telling you the pathogenesis over here. Okay. So first, let me write it down. Let me write it down. It would be easy. For after oral uptake of the bacteria, where did the bacteria go? The bacteria went in the distal ileum. Distal ileum. Now, in the distal ileum, it went where? It went to the Peyer's patches. Peyer's patches. Okay, special structures called as Peyer's patches. After crossing the Peyer's patches, it entered into the macrophages and infected the macrophage. It will infect the macrophage. It will infect the macrophage. Once macrophages are infected, now it is going to enter into the blood and cause septicemia. Now, once septicemia is caused, from here again back it is going to enter where? It is going to enter into your intestine, and from the intestine it is excreted in the feces. It is excreted back in the feces. So this is how the pathogenesis is taking place. All of you understood till here? Yeah. For the complete disease to occur, it would take around 50 to 30 days. Okay. It means the incubation period is how much? The incubation is period is around 5 to 30 days, not 50, I'm sorry, 5 to 30 days. Okay. Now, coming to the symptoms, from symptoms, definitely one question will be asked every year. From symptoms or diagnosis, definitely one question will be asked every year. So be careful with the symptoms over here. So here we divide the patient symptoms into 3 weeks. So week 1, what symptoms are there? Week 2, what symptoms do we see? And week 3, what symptoms do we see? Okay. Week 1, what will happen? Week 1, what will happen is that slowly the temperature of the patient increases. Obviously, any bacteria is entering into your body, temperature will rise. So in these patients also, the temperature starts to increase. Okay. Not only the temperature starts to increase, even the heart rate is also reduced. Reduction in heart rate is called what? Bradycardia. Bradycardia. Okay, this is done. Now in the second week, what is happening? Second week, what is happening is that whatever temperature has been increased. So all of you look here, starting what has happened? The temperature has increased like this. Now, whatever temperature has increased, that temperature will remain same for week 2, week 3. It means, what should I write here? Persistent fever. Patient will have persistent fever. Here also patient will have persistent fever. Persistent fever. Okay. But in week 2, what is going to happen? In week 2, slowly there are small rose color spots that are appearing on the surface of the body, especially around the navel. Now in this picture, I know you cannot see it, but this is the only best picture which I've got over here. I know you cannot see the dots over here, but I will try showing you these dots. You see a red color spot over here, 2 spots here, right? This is one more red color spot. Still, I think you cannot see these spots, but try finding another new picture on internet if you have, okay? But I only found this one. So what you see is that, anyways, no one is going to ask you image-based question from this. So what you see is that you would see rose color spots on the surface of the body, especially around the navel. This is very important finding. So rose colored spots. Where do you see these rose color spots? These rose color spots are seen around the navel, around the navel. Okay. So this is a very important question. Clear? Now by week 2, now by week 3, what will happen is that by week 3, ye dekho achhe se. Now by week 3, what will happen is that this bacteria will penetrate the Peyer's patches. From there, it will penetrate your intestinal wall and enter into your blood. It means intestinal perforation kab ho raha hai? Intestinal perforation is happening during week 3. Okay. So here, what is going to happen? Gastrointestinal perforation. If gastrointestinal wall is perforated, don't you think it will bleed? So obviously, patient will also have bleeding, gastrointestinal perforation and bleeding. Clear, clear all of you? All of you are clear with this? These are the 2 questions which will be asked usually. All of you understood this, yes or no? Everyone? Very good. So this is regarding week 1, week 2, week 3. You need to remember only one thing. In week 1, the fever will be increased. It will be same for week 2, week 3. Next, bradycardia will be there. Next, rose color spots will be there. And lastly, GI perforation will be there. right? Now, third important thing. What is the third important thing is that how do you diagnose this case? How do you diagnose this case is that, see, you diagnose this case with the help of this mnemonic, BASU. All of you know BASU? BASU. Okay. What is BASU over here? B stands for blood culture. B stands for blood culture. Okay. Or you can also do bone marrow culture. Bone marrow culture, blood culture or bone marrow culture. When do? You do it in the first week. In the first week, what is the diagnostic step you do? You take that is a blood culture or bone marrow culture. Now, do you think in the first week when the patient is coming to your doctor directly, if you are trying to take a bone marrow just for typhoid, will he allow? No. Yes or no? Obviously, he is afraid he won't allow you. So, what is the most common thing you do is that you take a blood culture. That is very simple. Okay. Next, sorry. A stands for what? Agglutination test. A stands for agglutination test. You know what is this agglutination test also called as? This is also called as Vidal test. This is also called as Vidal test. All of you know, right? Vidal test is there. So when this is done in the second week. Very good, Nishoka. This is done in the second week. Next, third important thing, S here stands for stool culture. S here stands for stool culture, and this is basically done in the third week. This is basically done in the third week. And finally, U stands for what? Urine culture. U stands for urine culture. And when is this done? This is done in the fourth week. So each week, what are the tests you basically do are these other things. So you can remember by the mnemonic BASU PASU. Okay. So this is very important. Diagnosis is very, very, very important. Very important. Okay. Right. So finally, what is the treatment which you give to this patient? What is the first line drug which you give? The first line drug is ciprofloxacin. What is ciprofloxacin? Anyone? What is the ciprofloxacin? Ciprofloxacin is your fluoroquinolones. Okay. Don't remember the classes now. Now only in the pharmacology you'll be taught anyways. Okay. So ciprofloxacin. For example, if the patient is developing resistance to this ciprofloxacin, then what do you give? Then you give something called as azithromycin. Azithromycin. If he is developing resistance, then you give azithromycin. Then what if the patient is having very severe infection? For very severe infection, you don't give these drugs, right? You go on to the higher grade, that is third generation cephalosporins. Third generation cephalosporins, any one example, guys, that is ceftriaxone. In case of severe infection, what you need to give is third generation cephalosporins, that is ceftriaxone. Ceftriaxone, which is third generation cephalosporin. Okay. All of you, Anas, understood? Everyone understood till here? Yeah? Everyone understood till here? What happened to everyone? Sleeping? You're understanding, right? Very good. Very good. Now, there is another concept. This concept is called as chronic salmonella carriage. What is this chronic salmonella carriage? What is this chronic salmonella carriage? Is it? For example, let us say this patient, let us say I am having chronic salmonella infection. Now, I don't have any kind of symptoms, no symptoms at all. But whenever you're checking the stools, right, for 12 months, continuously for 12 months, my stool will be positive for salmonella. But do you have symptoms? No, I don't have any symptoms. Then what is happening with you? What is happening with me is that I am carrying this salmonella for longer time. That is the reason why I am called as a chronic salmonella carriage. Okay. Now, In this chronic salmonella carriage, what did I tell you? There will be positive stool cultures. There will be positive stool cultures for about 12 months. Okay, positive stool cultures for about 12 months. Second important thing, if you see, the bacteria here, okay, the bacteria here, then where it is staying? You are telling you are not at all getting any symptoms. Then where is the bacteria staying? It can't stay in the blood because our immune system is ready to attack. Then where it is staying? It stays in the gallbladder. Okay, so where it is staying, the bacteria colonizes in the gallbladder. Colonizes in the gallbladder. Bacteria colonizes in the gallbladder. So this is a very, very, very important MCQ. Okay. Now, if bacteria is staying in the gallbladder for a longer time matlab kya? Almost till 12 months, 1 year, right? So don't you think anything can happen to the gallbladder? Yes. What will happen to the gallbladder? Anyone? When this bacteria is staying in the gallbladder for a long time, there is always an increased risk of what? Increased risk of gallbladder cancer. Increased risk of gallbladder cancer. Very, very, very important. Okay? Very, very important. So what I have to do, then what should I do? If I might get gallbladder cancer one or the other day, then what should I do is that the treatment which I will use is what? Ciprofloxacin. So you use ciprofloxacin for 1 month and that is enough. Okay. You can use ciprofloxacin for 1 month and that will be enough. Now, do we have any kind of vaccinations against this? Do we have any kind of vaccinations against this? Yes, we have got vaccinations against this typhoid. Okay. So it depends upon how you wanted to take a vaccine. You prefer oral or you prefer intramuscular vaccine. If you are preferring oral vaccine, then the vaccine which I will give you is live attenuated vaccine. The live attenuated vaccine. So if I ask you live attenuated vaccine is taken how? How it is taken? Orally, intravenously, intramuscularly, right? Live attenuated vaccine is taken orally. Okay. Now, when it comes to intramuscular route, intramuscular route, the vaccine which I am going to give is inactivated vaccine. Inactivated vaccine. Okay, the vaccine which I give is inactivated vaccine. What is the name of this vaccine? VI polysaccharide vaccine. What is this? VI polysaccharide vaccine. What is VI? Anyone? Can anyone tell what is VI? Yeah? Yes? What is VI, guys? VI in the sense virulent. VI in the sense virulent, not sixth. It is virulent polysaccharide vaccine. Okay. Very simple. Two vaccines are there. One is given intramuscularly, one is given orally. Orally is live attenuated, intramuscularly is inactivated vaccine. That is all you need to know. Is everyone clear with these organisms over here? Right? Now, the next important organism, later on in your fifth year, I think you will have a subject called infectious disease. Okay. You will have a subject called infectious disease, either in infectious disease or in this subject, microbiology. Out of these two, 100% this question will be asked on E. coli. Definitely, every paper you take it right now and you see every year this question is asked. Whether it might be FMGE, whether it might be NEET PG. Every year there is one question on E. coli. Okay. So learn this E. coli very nicely, I'm telling you. So the first, this one you understood, typhoid, paratyphoid, all of you understood? All these are the factual points only which you need to know. Right. Now, coming to this E. coli, what is this E. coli? E. coli is also a gram-negative bacilli. Okay. E. coli is also gram-negative bacilli. And if you remember, long ago itself, I think in second, third, fourth class, I think, I told you most common cause of urinary tract infection. Most common cause of urinary tract infection in women is what? Is this E. coli. You remember that? Third important thing, how this E. coli is transmitted. That is a very important question. How is a E. coli transmitted? E. coli is transmitted through three ways. Okay. First important way is fecal oral. First important way is fecal oral. Second important way is urethral ascension. Third important way is catheter. Third important way is catheter. What do you mean by urethral ascension? Urethral ascension matlab there is nothing big in this. See, this is urinary bladder. This is urethra. Okay. Let us say E. coli is in the urethra right now. Okay. Now what will happen? This E. coli will ascend up and it will enter into your where? It will enter into your gallbladder and infect the gallbladder. So this infection is ascending up, going up. That is why you call it as urethral ascension. Okay. And catheter. Catheter in the sense, you put a Foley's catheter into the patient, right? The urinary pipe, which you basically call it as. So that Foley's catheter, if you are not changing it at least weekly once, right? If it is there for about 2 or 3 weeks for a bedridden patient, so very easily bacteria from outside can directly enter into your urinary bladder. Okay. So these are the three important routes of transmission which you need to know. Clear? Now, apart from this, an important thing is that normally all of you, what do you know? E. coli is present in all of us and E. coli is very good. Why? Because you consider E. coli as a normal microflora. Yes or no? Normal microflora of your intestine. And if you're trying to kill this E. coli, then the process of digestion and all of these, there will be a little bit disparity. It means there will be a little bit problem in this digestion process and all. But not all strains of E. coli are good. There are some strains of E. coli which are very pathogenic. Okay. So now we will mainly concentrate on what are these pathogenic strains. We will concentrate on what are these pathogenic strains of E. coli. So let us see what are the pathogenic strains of E. coli. Now coming to the pathogenic strains of E. coli, just remember a mnemonic HIT. HIT, hit. Okay. What do you mean by H? All of you look here. EHEC. What do you mean by H? EHEC. What is EHEC called as? Enterohemorrhagic E. coli. There is one variant of E. coli, one type of E. coli called as enterohemorrhagic E. coli. Okay. Next important one is EIEC. EIEC in the sense what? Entero-invasive E. coli. It means, can I tell this will invade your body inside, right? It will perforate your intestines. Entero-invasive E. coli. And finally, we have got T, that is ETEC. T stands for what? Toxigenic. Enterotoxigenic E. coli. So how many three important strains which I am teaching you here? HIT. HIT stands for what? Enterohemorrhagic E. coli, enteroinvasive E. coli, enterotoxigenic E. coli. Clear? Enterotoxigenic E. coli. So till here, all of you understood. Now, out of these, just by looking at the words, tell me which E. coli is sounding very difficult. I mean, very dangerous. अभी enterotoxigenic E. coli or enteroinvasive E. coli or enterohemorrhagic E. coli. Invasive, ठीक है, invasive will invade, fine. But look at enterohemorrhagic. It is going to cause a hemorrhage. It is going to cause very severe bleeding. Okay. So enterohemorrhagic E. coli is a very dangerous form. Okay. Now let us write down. Let us look into little more details of this. You will understand now. Enterotoxigenic E. Okay. Sorry, I did not write it here. Enterohemorrhagic E. coli. Enterohemorrhagic E. coli. Okay. Next, we have got enteroinvasive E. coli. Okay. Next, you have got enterotoxigenic E. coli. Toxigenic E. coli. So these are the three different types of E. coli which you have. So first is enterotoxigenic E. coli. Next is enterohemorrhagic E. coli. Next is enteroinvasive E. coli. Enteroinvasive E. coli. Enterohemorrhagic and enteroinvasive E. coli. Okay. Now all of you look at this. When I tell enterotoxigenic E. coli, only one thing. Enterotoxigenic E. coli will cause watery diarrhea. Watery diarrhea. Okay, it will cause watery diarrhea. Now, enterohemorrhagic E. coli. When I tell hemorrhagic, it means blood. It means diarrhea is watery or bloody diarrhea. Tell me. It causes bloody diarrhea. It causes what? It causes bloody diarrhea. Clear, all of you? Now, entero-invasive E. coli. Now, what do you mean by entero-invasive E. coli is, just look here. I'll go with a little concept here instead of directly telling you the point. See, these are the layers of your intestine. This is the innermost layer. Okay. Innermost layer is called as mucosa. After the mucosa, the next important layer you have got over here is this one. What is this layer? This layer is called as submucosa layer. After submucosa layer, the next layer you have got over here is this one. This is called as your muscle layer. Okay. So this layer over here is called as your muscle layer like this. After the muscle layer, the outermost layer which you see, that is called as serosa. Yeah. So this outermost layer is called as serosa. Okay. Then what is the layer which you just now told here? ये वाला layer कौन सा था? This is called as your submucosa layer. Right? This is your submucosa layer. Now, what I'm telling you is that if you look, where are your blood vessels located? Your blood vessels are located in mucosa? No. Your blood vessels are located in the submucosa. See, these are the blood vessels which are located within your submucosa. Okay. Now, what do you mean by entero-invasive? Entero-invasive matlab, this bacteria which is present over here, this will start invading your body wall. First, it will invade what? It will invade serosa. Okay. First, it will invade serosa. When it will invade serosa, it is going to cause what kind of diarrhea? Watery diarrhea. It will cause watery diarrhea. Okay. Later on, the bacteria is going much more deeper inside till submucosa. Submucosa में blood vessels है. Don't you think this bacteria will rupture the blood vessels? Yes. If this bacteria will rupture the blood vessels, then from the submucosa, blood is also going to come. So patient will tell, doctor, initially I had watery diarrhea, but slowly now I have bloody diarrhea also. Bloody diarrhea. Not only bloody diarrhea, doctor, another thing also patient will tell. Look what patient is going to tell, that his serosa is damaged and his submucosa is damaged. Then when this damage is going on, do you think your immune system will sit simply? No. Your immune cells will come. Your neutrophils are the first ones to reach there, Any injury in your body, neutrophils are the first one to reach there. Neutrophils will come here, eosinophils, macrophages, monocytes, all the cells will come here, right? So overall, what is the result? The result is formation of pus. So he will tell, doctor, now I have bloody diarrhea plus pus discharge also. This is what is called as entero-invasive E. coli. All of you understood till here? Everyone, jaldi batao. Perfectly clear, right? Yeah, only one understood. Only two members understood. What about the remaining? Royal Ratna, you're here. Right. Now, next important thing, and all the time the question is asked from this part. Mostly the question is asked from enterohemorrhagic E. coli. They usually rarely ask in toxigenic and invasive, but most of the time they ask regarding the enterohemorrhagic. Why? Because enterohemorrhagic E. coli is associated with HUS in the sense hemolytic uremic syndrome. Hemolytic uremic syndrome. What do you mean by hemolytic uremic syndrome? What do you mean by hemolytic uremic syndrome is that there is within this enterohemorrhagic E. coli, there is one very powerful variant. Okay, what is that powerful variant? You know, O157 hash H7. ये number को ना, you just have to remember it at any cost, guys. Lifelong you have to remember it. O157 H7. Okay, O157 H7. This is one of the very dangerous variant of E. coli. You know what does it do? It would damage your kidneys. If it is damaging your kidneys, can I write it as acute renal failure? ARF stands for acute renal failure. It will damage your kidneys. Second important thing, apart from damaging your kidneys, it would also do one more thing. It will cause lysis of your RBC. When it is causing breakdown of your RBC, hemolysis of your RBC, the anemia which you get is what? Iron deficiency anemia or hemolytic anemia? Batao? What kind of anemia you get here? Iron deficiency anemia. Very good. Nishoka, very good. So when RBC is broken down, that kind of anemia is called as hemolytic anemia. And you know, one more additional feature, what does it do? It will even break down the platelets also. When platelets are broken down, now tell me the level of platelets will be normal or low? Low. So this condition is called as thrombocytopenia. Thrombocytopenia. So from today onwards, in the exam question, if you see, very, very important, guys, I'm just giving you a very nice trick. Remember it, because most of the students couldn't solve these questions. Most of the students, in the sense, the students who are appearing for USMLE also, they couldn't solve these questions here because of a trick here. Very easy trick. In the question, you read the question totally, okay? In the question, if you want, you can write it down, this hint also. In the question, if you see diarrhea, regarding bloody diarrhea and all, okay, one thing should come into your mind: E. coli. Obviously, there are many other causes also. Just keep into your mind, as far as the topic is concerned, E. coli. Along with that, along with that, if you see any kind of urinary problems in the sense patient is not able to pass the urine properly, right? All these things. So it means patient is having acute renal failure. Now you need to get a doubt there itself. Why a patient of diarrhea is having a renal problem? Why a patient of diarrhea is having a renal problem? This is the only link. Okay. Next, what they will tell is that patient is weak all the time. He is pale all the time. Paleness, weakness, tiredness. These are the symptoms of anemia. Remember, paleness, weakness, tiredness, easy fatigue. These are the symptoms of anemia. Next, patient will also tell that, doctor, on my legs, on my lower limbs, nowadays I can see red color rashes. These red color rashes are nothing but called as petechial rashes. All of you have studied, if thrombocyte level is low, then petechia will be formed on your body, right? So if you see these complaints, what are the complaints? Bloody diarrhea plus renal problem like unable to pass urine, oliguria. Oliguria in the sense less urine passage. Okay. Next, patient is complaining of anemia, right? Patient is complaining of what? Anemia. Patient is complaining of petechial rashes. If you see these things, directly go for E. coli O157H7 variant, that is enterohemorrhagic E. coli. Will you all remember this? Yes or no? Jaldi batao. All of you understood this part? Yeah? All of you understood this? Very good. Very good. Right. Now, an important thing is that what is the test you do in entero-invasive E. coli? There is a specific test here to remember, guys. There is a specific test to remember that is called as Seren test. That is called as Seren test. You know what is this Seren test? What is this Seren test? Is that very simple, very simple. What you do is that you take this kind of bacteria, entero-invasive E. coli, right? And what you do is that you add this bacteria, you inoculate this bacteria into a pig's eye. Usually you choose a guinea pig. So you inoculate this bacteria into the guinea pig. Now, in the guinea pig, if you find keratitis and conjunctivitis, it means patient is positive. Okay, so that test is called as seren test. Just remember it as seren test. Okay, so in seren test, what you do, you add drops of this bacteria onto the pig's eye. In the pig eye, in the next day, if she develops keratitis and conjunctivitis, it means it is positive. It means the bacteria is present actually. You can't add it in the human eye, right? So that is why you choose an animal. Right. So I hope till here all of you are clear. Yes or no? Jaldi batao. Right. So this is all the important things that will be asked. Now switching on to another cause of diarrhea, that is Vibrio cholera. Vibrio cholera. Vibrio cholera is such an organism which is comma shaped. Vibrio cholera is a comma shaped organism. Comma shaped organism. Okay. And remember one thing, this Vibrio cholera is also a gram negative rod shaped bacteria and it releases cytochrome oxidase. जो भी bacteria na, if it is releasing cytochrome oxidase, that bacteria is oxidase positive. If it is not releasing cytochrome oxidase, it is oxidase negative. So this is oxidase positive bacteria. Okay. अभी ये बैक्टीरिया का फ्लैजेला भी देखो. This is a bacteria like this. Why are you drawing it as a curved form? Because that's what I told you, comma shaped or curved bacteria. Comma shaped or curved bacillus. Now this bacteria is having a flagella on one end. So can I call it as polar flagella? Polar flagella. Why polar? Because it is only on one end. ये देखो, polar flagella. You see this? Only one flagella on one end. This is polar flagella. Okay. Again, any kind of diarrhea problem, any kind of diarrhea, any kind of vomiting, the transmission all the time will be fecal-oral route. So most of the time you will see fecal-oral route of transmission. Okay. How are you going to get Vibrio cholera? Vibrio cholera is not present in your body as a normal habitant, right? How are you going to get is that, for example, if you are eating a raw seafood, okay, raw seafood, or let us say you traveled somewhere. Obviously, you go on for traveling and all, right? So you go travel all the way and then come telling to the doctor, now you are having diarrhea. It means it is because of Vibrio cholera. Okay, it is because of Vibrio cholera. All of you understood this? Yes or no? Jaldi batao. Everyone. Now all of you look here. I'm sorry. Coming to the pathogenesis, how this will cause diarrhea in your body. See, let us say this is one cell of the intestine which I'm drawing right now. I'm drawing one cell of your intestine. Okay, one cell of your intestine. Now, on the surface of your cell, you have already got a very important structure over here. This structure is called as adenylyl cyclase. AC. What is AC? AC stands for adenylyl cyclase. Okay. Now, what this adenylyl cyclase will do? What this adenylyl cyclase will do is that this Vibrio cholera releases a toxin called as cholera toxin. What is the toxin it is releasing? It is releasing a toxin called cholera toxin. Cholera toxin is having two subunits. This is A subunit and this is B subunit. ये concept तो आप लोगों को पता है. This is A. One is called as A subunit. One is called as B subunit. Okay. Now what is happening? Look, this particular A subunit will enter inside the cell. Okay. It is entering inside the cell and this A subunit will activate your adenylyl cyclase. It is activating your adenylyl cyclase. Once adenylyl cyclase is activated, this adenylyl cyclase क्या करेगा? Cell के अंदर ATP होगा. Yes or no? All the ATP whatever are present in the cell is converted into cyclic adenosine monophosphate. Cyclic AMP, CAMP, which is also called as CAMP. So more the toxin. So can I tell more the toxin, more the CAMP? Yes or no? You know what a CAMP will do? Yes, CAMP क्या करेगा? It will activate some more proteins. This thing will be taught in pharmacology. but I'm just briefly telling you that this CAMP will activate some more proteins. Some more proteins, matlab there is one more protein called as PKA, protein kinase A. This will activate PKA. If you want to remember it, or else not at all a deal. In biochem, not pharma, sorry, in biochem you will be taught this. Okay. So PKA is activated. अभी ये PKA क्या करेगा? ये सेल के अंदर, within this cell, no matter how much chlorine is there, what this PKA will do is that this PKA will throw all the chlorine out into the lumen. Into the lumen. Now, once the chlorine is coming out, along with the chlorine, what will come? Along with the chlorine, water also will come. Okay. So chlorine and water together will be excreted in the patient's what? I mean, in the stools, right? So this kind of diarrhea is called as what kind of diarrhea? Secretory diarrhea. Secretory diarrhea. Secretory diarrhea. Obviously, sir, you told only two. There is watery diarrhea. There is bloody diarrhea. Obviously, this is watery diarrhea only. यहाँ पे blood कहाँ पे है? There is no blood here. It is watery diarrhea only. But there is secretion of what? There is secretion of chlorine. So if you see within the blood, the levels of chlorine will be low. Hypochloremia will be there in the blood. Right? In the stool, there will be hyperchloremia. Clear? Now, if you look at these stools, literally, guys, when you eat the rice, right? Before eating the rice, you wash the rice. When you wash the rice, you see the white color water that is coming out of the rice. Yes or no? So exactly the stools also look the same. Okay. That is why you call those stools as rice water stools. Rice water stools. Okay. Rice water stools. Now, because of this rice water stools, lot of water is going out, and this would lead to severe dehydration in the patient. Severe what? Severe dehydration in the patient. I hope till here all of you understood. Now, every year, you know what question is asked here? What question is asked is that cholera toxin activates, increases the level of which particular component within the cell. So remember this. If you don't remember the entire thing which I've taught you, also remember this, that cholera toxin will cause activation of cyclic AMP. By a process of activating cyclic AMP, it will cause diarrhea. ये बहुत important है, बहुत important है. You have to know mechanism of each and every toxin. बस एक point काफी है ना? So cholera toxin will cause increase in CAMP levels, cyclic AMP levels. Clear all of you? Now coming to prevention, how do you prevent this? How do you prevent this is that very simple thing. Stop eating contaminated food and water, drinking contaminated water and all. That is the preventive method which we use. But when it comes to vaccine, here the vaccine which you use is live attenuated vaccine. अभी ये देखो, already you told one live attenuated vaccine. कहाँ पे बोला था? Yeah, here. What is the route of entry of this live attenuated vaccine? Oral. So यहाँ पे भी क्या होगा? Oral ही होगा. Live attenuated oral cholera vaccine. Oral cholera vaccine. All of you understood? Yes or no? Very good. Now look at the initial test. What is the initial test you do? What is the initial test you do is that, see, very simple test. Very simple test. Nowadays, you know, not now, even from my childhood onwards, those things are coming. You see, there are, let us say there are chocolate wafers. Okay. There are chocolate wafers in one container, right? And there is chocolate in the other container. So you take this chocolate sticks and dip in that and then eat it. You know that, right? So what is that? That method is called as dipstick test. Dipstick test. What are you dipping? You are dipping it into what? You are dipping it into chocolate. Chocolate. CHO in the sense what? CHO in the sense cholera. CHO in the sense cholera. ऐसे याद रखो. ठीक है? So what is the initial test you do in cholera? Dipstick test. Dipstick test is the initial test which you do in cholera. यहाँ पे chocolate कुछ नहीं है. Dipstick test for mnemonic purpose. I told you dipstick test you do here. Why are you doing this initially? Because ये rapid है, बहुत fastly results आ जाएगा. Very fastly you are going to get the results. That is why you do this test. Then what is the test which is very good, confirmatory, and okay, let it take longer time, but the result should be perfectly accurate. Such test is called confirmatory test. That is stool culture. You collect the stool sample, send it to the lab. It would take few days for the stool cultures to come back. Okay, all of you understood this? Yes or no? Now you might ask, sir, इसका treatment क्या है? अभी ये देखो, when the patient is coming, you don't give him antibiotics. Okay, what you give him, you give him intense fluids. Patient is severely dehydrated. Now you rehydrate the patient. Okay, that is the only treatment plan which you give here. Okay. All of you understood? Yes or no? Jaldi batao. Please tell me. All of you understood? Yes or no? Royal Ratna slept. You're sleeping. I'll complain your father if you're sleeping. Right. The next important thing is Pseudomonas aeruginosa. Now, I told you regarding this Pseudomonas aeruginosa, I think long back. Pseudomonas aeruginosa releases a pigment that is called as CV Raman. You remember this? It releases a pigment called as CV Raman. Now, what is this CV Raman, guys? Anyone? Any idea? ये बताओ, C stands for what? Cyanin. Pyocyanin. Pyocyanin is which color? The pigment is which color? बताओ. Pyocyanin color देखो यहाँ पे. Blue color. Very good. Pyocyanin is blue color. Pyoverden. Verden. Very good. Verden is green color. Verden is green color. And pyorubin is red color. Pyomelanin is brownish black color. Brownish black color is pyomelanin. Okay. ये देखो. Look at this. Now tell me, by looking at this, which pigment is released here? Which pigment is released over here? Anyone? Very good. Very good, Karan Raj. Very good. Perfect. Kajal, very good. Pyoverdin is released over here, right? So the pigment over here is pyoverdin. Pyoverdin is released over here. Let us discuss regarding the virulence factors now. What are the different kinds of virulence factors does it release? So you wanted to remember the virulence factors, remember it by the mnemonic PEEP. P-E-E-P. If this bacteria has to enter into your body, पहले क्या करना चाहिए? ये bacteria has to damage your cell membranes. If this bacteria should damage your cell membranes, then this bacteria is going to release phospholipase C. Phospholipase C. What does this phospholipase C will do? This phospholipase C degrades the cell membranes. Okay, it degrades what? It degrades your cell membranes. Second important thing. What does E stand for? E stands for endotoxin. Now, I won't tell you about endotoxin because we have already discussed enough about this endotoxin if you remember, right? Endotoxin causes three important effects. What is the three important effects? One is it causes fever with the help of interleukin 1. Yaad hai? You remember? Fever. It causes hypotension, and it causes disseminated intravascular coagulation. These are the three things. Very good, Romita. Hypotension. Severe form of hypotension is shock, right? So fever, hypotension, disseminated intravascular coagulation. These are caused by endotoxin. Now, this bacteria will also release exotoxin. Uska naam hai exotoxin A. You know what does this exotoxin A will do? Again, this is one of the important question which is every time asked. Remember this, very important. पता है exotoxin ये क्या करेगा? All of you know that this is your mRNA. Okay. On the mRNA, you have got your, let us say, ribosome. Okay. Now, what this ribosome will do? This ribosome keeps on forming a protein. है ना? ribosome. See, one amino acid will come and attach. One amino acid will come and attach, right? Another amino acid, another amino acid, another amino acid, another amino acid. So like this, a chain of amino acids will join together to form a protein. So actually, यहाँ पे क्या हो रहा है? The chain is getting elongated. Who is elongating this chain? The chain is getting elongated by elongation factor number 2. Very, very important factor. Let me write it much more clearly. Very, very important. Elongation factor 2 is causing elongation of this chain. So what this exotoxin A will do, this exotoxin A will completely destroy this elongation factor 2. So once elongation factor 2 is inhibited, then what synthesis is inhibited? Protein synthesis is inhibited. So in this patient, protein synthesis is inhibited. Don't worry about each and every toxin, about their mechanism of action. Separately, I will make a table and I will write it down later on. Okay, but for now, as we are discussing this, remember this. Okay, but again, I'm telling you, stressing this point, very, very important. Exotoxin A, elongation factor 2, protein synthesis. Very, very, very important concept. Okay, very, very important. Next important thing is that P is phospholipase. E is endotoxin. E is exotoxin. And what is P again? P stands for pigments. P stands for pigments. Okay. Pigments already we have discussed. Clear all of you? So these are the virulence factors. Sir, what are the diseases that are caused by this? Just remember the diseases by the mnemonic here, Pseudomonas. Okay. So what does this Pseudomonas stand for? P stands for pneumonia. P stands for pneumonia. S stands for sepsis. Okay. E stands for ecthyma gangrenosum. Ecthyma gangrenosum. What do you mean by ecthyma gangrenosum? You see, this is mostly seen in the infants, okay, the newborn. All of you look at this, these lesions over here on the face, on the lips, everywhere. This is called as ecthyma gangrenosum. Clear, all of you? Next, U here stands for urinary tract infection. D here stands for diabetes mellitus. O here stands for osteomyelitis. Osteomyelitis. And N here stands for nosocomial infections. S here stands for skin infections. Skin infections. And finally, C stands for cystic fibrosis. Cystic fibrosis. Skin infections in the sense are what skin infections? A particular skin infection called as hot tub folliculitis. Hot tub folliculitis. Folliculitis because of sitting in the hot tub for a long time. Now, because of sitting in the hot tub for a long time, you can also get one more infection that is called as Legionella pneumophila, if you remember. Legionella pneumophila. This is another important infection which you can get. Right? So guys, all of you understood everything which I have taught you today. Jaldi batao, very fastly. All of you understood? What about the remaining students? Only 30 students. Yeah. You're not understanding whatever I'm teaching you, or you think this knowledge, whatever I'm teaching you, the level is very less in compared to the things which you are studying, or busy in sleeping because of heavy snowfall there. Batao, what can be the reason? What reason do you think? Comment down. What is the reason do you think? Or they're standing in the line with their plate in the mess. What can be the reason? Batao. At least I should know something, right? Why students are not attending the classes? I should know this. Exam, कौन सा exam? Which exam? You, when do you have exam? Do you have micro exam? When do you have microbiology exam? माइक्रोबायोलॉजी का एग्जाम कब है, याद है? कि एक दिन पहले पता लगेगा? हाँ, थर्ड ईयर, राइट? फॉर द नेक्स्ट सेमिस्टर यू हैव, नेक्स्ट सेमिस्टर यू हैव, फॉर द नेक्स्ट सेमिस्टर यू हैव, राइट? माइक्रो रिवर्क्स. Right. So whatever it is, guys, whatever I'll be teaching you again, maybe, in case there is no replacement, in case no other faculty comes, then I will only continue teaching you microbiology next year also, even for your final year also. By the time you come final year, get ready for the entrance test. For that also, I will only come, I think, most probably. Right? So tomorrow we shall continue the remaining. So this is all for today. So hope you all understood yesterday's notes. I have already posted it in the group, right? Regarding the video I'll upload it mostly tonight or tomorrow early in the morning. I will upload the video. Okay. So regarding today's notes, I will upload it right now. Okay. So all of you understood whatever I've taught today. Everyone perfectly clear, right? Very good, guys. So thank you so much for your patience. Goodbye and love you all.